wants us to get a blood collection from you, a sample from your arm. We're going to do a dressing change on your central line, and we're also going to get a blood collection from that your central line as well. Do you have any questions? And is it okay if I do this with you? All right. Are you taking any anticoagulation therapy or blood thinners? No? Okay. And let's look at your arms here. Let's see which one would be good. Have you had your blood drawn before? Do you have preference of which arm? There's no bruises or scrapes or anything else, moles that would get in the way. Okay, so it looks like we'll use your right arm. All right, so first let's just get you set up. We'll do the blood collection from your arm first, and then we'll do the dressing change. And then we're gonna have you sit up just for a little bit. And then when we do your dressing change, it needs to be, is what is called sterile, so the cleanest way to clean the dressing. So you'll wear a mask and I'll wear a mask, but just in a little bit, okay? All right, and then for demonstration purposes, I'm gonna come over to the counter here and place supplies. Alrighty, so looking at your arm here, I would have gloves. Let me get those real quick. Okay, so with my gloves, I'm gonna fully hand wash and put on new clean gloves. I'm gonna look at and I've looked at my supplies and the doctor's orders and know everything what's needed to be collected and which orders. My supplies is not damaged and in good expiration. So pull that back. Okay. Let's look at which vein we're gonna use here. And to keep this clean, I could put a new blue Chuck's pad underneath my patient. This is gonna be tight just for a moment. We're checking which vein to use. All right, that looks like a good one. All right, we're gonna go ahead and clean it, and I've checked if you're allergic to any chlorhexidine. And this needs to be cleaned for 30 seconds. We go horizontally, vertically, in a circular motion. And that can be disposed of. While that dries completely, we're going to get the supplies ready and set up. And we'll do the scoop method. Okay. All right. And we'll have that. Okay. Okay, it's gonna get tight here just for another moment. All right, on the count of 3, you're gonna feel a poke, okay? 1, 2, 3. Looks like we got some blood return. Okay, and then I'm going to remove the needle without putting any pressure on the needle. And putting the safety on, I will label, this will go in the sharps. I'll label the patient's name, date of birth, time collected, my initials, and confirm that information with the patient, at least their name and date of birth. And this would go in a biohazard bag. And then let the patient hold it for 30 seconds. If the patient was on an anticoagulant therapy, Pressure would need to be held 5 to 10 minutes. And I'm also going to place a bandage. How are you feeling? Doing okay? Alrighty. And this can be thrown away. Take it out. Alright, and then I would take off my gloves. Gonna perform hand hygiene, and I'm gonna put my mask on and my patient's mask on. Some hand hygiene. Alright, and it's best if you look away towards the window like you are, since your dressing, your central line is on this right side here. Okay. Alright, I'm gonna move this garbage over here, have hand sanitizer, and right now I'm gonna fully wash my hands. Okay, and inspect my supplies. Okay, everything is good, expiration, it's not damaged. I'm gonna open it away from me and throw it away. I'm going to now put on, no, I'm not gonna do anything. I'm gonna put, before I grab anything, I'm going to hand sanitize, put on some clean gloves, and remove the dressing. All right, and how's your pain at the moment? Any pain where the central line is inserted? No, okay. And I could hold some pressure if needed to keep that insertion site stabilized without putting a lot of pressure. And I'm going to notice the skin at the insertion site. I'm going to notice the skin surrounding, and I'm going to notice the tubing of the insertion, and it looks intact. I'd make sure to document that as well, and that dressing would have been discarded per policy, per facility policy. Okay, and now I would like to fully wash my hands. Okay. And then I would come to my supplies now, and I would look at my kit to make sure that's in good expiration, unravel it, and now become sterile. I'm going to now take out some of my supplies and set up on my sterile field over here. Okay, I would clamp down, and we're gonna clean back and forth. Okay, I'm now going to take my tweezers and hold Okay. I would let that time to dry. This would be discarded. I'm going to now do my skin preparation. Back and forth. And vertically. And I would allow this to dry completely before applying the bandage. So that would be completely dry. I'm going to now take this sterile 2x2. Place it securely around without putting too much pressure on the tubing. And now put on the transparent dressing. How are you doing? Any pain? Making sure to ensure that the edges are moved down and without putting too much pressure on the insertion site. Okay. And removing. Okay, and I'm going to put this label on. My initials, today's date and time of 1:55 would be placed on. Okay, and now I'm going to clean the other tubing along down. So I'm becoming unsterile now. And one more time. Okay. Now I'm going to take off my gloves, perform hand hygiene, and put on some clean gloves. Now we're going to get a blood collection, okay? And I'm just making sure I have everything. Yes. Alright, so this would become in a new package. I'm going to hold this. I'm going to place this down for a moment, unscrew the cap, and this would be discarded. For old, that would be in the trash. We clean it for 5 to 60 seconds. Okay. Now I would have this, and I would make sure to not touch the inner cannula, but take off the cap and remove any excess air. I took out 1 milliliter, so we have 9 milliliters here. I'm going to screw that on, uncap, put in a couple milliliters, and aspirate. And there is, if you could see, there is some blood return. So now I'm going to flush the remaining 7 milliliters. Okay, clamp. But I'm going to keep it unclamped and get my waist to 10. And you can see that blood return for wasted. Okay, now clamp, remove, and this would go in a biohazard garbage bag per facility policy. And this is that bag, okay. Now I'm going to, sorry about that, I will take care of that. Clean for 5 to 60 seconds. It's clamped, yeah, okay. And with a new syringe, I reviewed the doctor's orders, and he's ordered for 5 milliliters of blood. Clamp. And note that that's 5 milliliters. I'm going to now, it's clamped. And over here, take out any air. Okay. And get my vial. This would be labeled with the patient's name, date of birth, and my initials and today's date. And I would confirm the patient's name and date of birth with them, and this would go in the biohazard bag. And this would go in the sharps container. Okay, now we need to flush another 10 milliliters through. How are you feeling? I'll pick that up. Okay, and with a new saline flush, 10 milliliters, good expiration. Get the excess air. Still have 10 milliliters. Unclamp and begin to flush those 10 milliliters. In garbage. Clean to 5 to 60 seconds. This is my new cap that I would open, and it is new and sterile. And cap onto the patient. And the whole time that I'm doing this, I'm making sure not to tug on the catheter tubing. All right, okay. I'm going to clean up my supplies. make sure the patient is comfortable and in good position. I'm going to take off these gloves and fully perform hand hygiene. Put this in these sharps. Biohazard. And again, I'm going to clean up my supplies. I would lower the patient to a comfortable position, remove the patient's mask, my mask, make sure the call light is in with reach, document. I'm going to document how well the patient tolerated procedures for both the venipuncture and the dressing and blood collection. I'm going to document the site of blood collection for the venipuncture on the right arm and specify the vein. I'm going to document the skin at the insertion site, the skin surrounding, and the tubing that it was intact. I will document any pain that was tolerated or if the pain was okay throughout, and I believe that is it.